again, just full of piss and vinegar at the time, which is what I'm going to talk about next, right? So basically, at this time, I was really starting to understand that PT had a real poor brand awareness. And I think probably because of SEO and those types of things were going on with the internet, branding was starting to become the big buzzword. When I first started opening my business, you got to do all this stuff for branding. But when you look at the branding of a profession, right, and what brand means, right? Brand means, what does everybody think of when they hear about your name of your product or your product? What does somebody think? Right? That's what your brand is, right? And basically, when you think about physical therapy, people don't understand what it is, right? It's very confusing. One of the reasons is because we have 9 board specialties, right? You have geriatrics and cardiovascular and pediatrics and neuro and orthopedics and sports. And so when people encounter PT for the first time, there's so many different ways that it happens that it really confuses everybody, right? But the one that we know for sure is that most people think, okay, well, I'm going to go to see a physical therapist after I see my doctor for this injury or pain that I'm having. That's typically the scope that people see us in, right? If they have back pain, they go to a chiropractor. If they have jaw pain, they go to a dentist, right? They're not going to come to see us, even though if they have a foot and ankle problem, they go to see a podiatrist, right? Those are all within our scope of practice, but people don't come to see us directly for it typically, right? And our national averages are really poor with that as well. And at this time, we were really moving towards becoming this more preventative, proactive, practitioner, which when we look at prevention, there's more than just primary prevention, right? Which primary prevention is trying to stop something from happening at all, right? So we're going to try to, completely prevent any injury or any bad thing from happening. But secondary prevention is trying to stop some of the things that are going to happen as a sequelae, right, from that. Right. And then tertiary prevention is basically where you get into the palliative things. You're trying to stop things from happening or getting worse. Does that make sense? It's kind of at that point where you're really not going to be able to make things better, but hey, let's not make it worse, right? So no matter what we're doing, we should always be thinking, be proactive, right? And I've really been thinking about this a lot lately, where, you keep hearing discipline, and I love Jocko Willink and these Navy SEAL guys and the Goggins Fever and Joe Rogan and all these guys that are, putting out all this badassery type of stuff, right? But it's not always about being a badass. It's not always about being tough. It's not always about being miserable, right? That's not how we need to lead our lives. It's about being proactive, right? So, and the more proactive you are, the more you're going to understand, well, yeah, why wouldn't I operate on all these levels of prevention if I can't, right? Why am I going to try to make something worse or let something become worse in the scenario when you don't have to, right? So, and then at this time, again, too, most PTs aren't trained in the new ideas still, right? Most PTs, even getting out of PT school, aren't ready to go and be a direct access practitioner, right? Where you're able to see somebody straight off the street. I was lucky at the time because my first job out of school was at the University of Cincinnati, where I worked in the training room, where I was seeing people right off their injuries, right? I was seeing the injuries happen while I was on the field. So I felt like I was really, really ready for something along those lines of, handling the direct access. So when I got out of Cincinnati, I was ready to go. So, I felt like I came up with this concept, but I know some people are using it more now, of this idea of performance enhancing physical therapy, PEPT. If you guys look, I made videos about this on YouTube a while back. And this idea that, basically for athletes, we're typically being trained or utilized in the, as physical therapists to improve performance, right, with athletes. Most of my pro athletes that I've worked with over the years, that's one of the reasons why they were coming to me, right? They wanted to get rid of the pains that they were having, but they also were looking at improving their performance. And we see that, across the board in all sports today. Most high-level athletes, even in the NFL now, it's mandated that you have a licensed physical therapist on your staff, right, in the NFL. I don't know, did any of you guys know that? I solidified that and found that out when I got hired by the AAF. Did you guys know that was true? I don't know if there's any other leagues that are mandated that way, but the NFL is for sure. Yeah, it's pretty cool, right? So the Alliance of American Football, that football league that started 2 years ago and then failed. That's why I moved out to California. I got hired by them. And when I got there, I had learned, or actually was in the courting process, that I had learned that the NFL had made a new rule that they mandated that you have to have a physical therapist on staff for every team. Every team had to hire a physical therapist, which was pretty cool. It was a big move, right? And I have this thing here that says zombies versus athletes, right? So I'm going to try to not beat this up too bad. But when I was in Erie and I was working, one of the PTs that I was working with, we were doing a little bit of a case review, and we were at the office, and there was 6 or 7 of us PTs sitting there talking about this patient, and he goes, I don't really know. This lady's not making much progress. I don't really know what's going on with her, man. Like, it's crazy, and I don't remember. She may have had a hip replacement or a back surgery or something. And he goes, yeah, it just doesn't make any sense. She only has diabetes. I was like, what? You look at those statistics that we were just talking about. I know, Sean, you missed some of those. It was like, you only have diabetes? You got to be kidding me. Right? Diabetes means you're dead. Your body is not working anymore. If you have diabetes and your insulin's not working, you are going to die very soon, right? Especially if it's type 1. If it's type 2, you may be a little bit more miserable for a while, but you are on a fast track to death. And so our medical system keeps everybody alive, right? So a few years later after this, I'm going to Erie. I can't remember if it was for a golf outing or some type of alumni thing or a wedding or whatever, and I had to stop at the mall. I really, it's in my mind that I had to buy a belt or socks or something. It was something stupid, right? So the Mill Creek Mall in Erie is a big mall that serves like this whole regional area, right? It's the only mall around, and it's fairly nice relatively, right? And so as you would pull in, there's a Red Lobster there. There used to be a Ponderosa Steakhouse. There's a Starbucks, and there's some other nice restaurants, right? And in place of where the Ponderosa Steakhouse used to be was a DaVita dialysis clinic right next to the Red Lobster, right? And I'm going, whoa, what is going on here, right? What society do we live in that we're going to put a DaVita dialysis clinic right next to a Red Lobster, right? And maybe today that's normal, but it wasn't like that when I was coming through. Right? So, and like I said before with the diabetes issue, kidney disease is one of the biggest problems that we have, right? So, but if you look at the second bullet point down under the PEPT, right, in our healthcare system, we don't consider running an activity of daily living, right? So what does that do to our ceiling for everybody, right? We basically do sickness care, right? We're managing sick people, and we're not really working on health, which is a cliche thing. But when you look at all these things that we're talking about, I mean, it's really bad right now, right? So, and everything was starting to, a big shift was changing at this time because of all of those statistics that I told you, right? Everybody's moving more towards this health and wellness and basically, looking at improving somebody's condition. But one of our problems that we have is that insurance only pays for symptoms. So as soon as you get rid of symptoms from somebody, the insurance company goes, oh, well, why should we pay you to do anything anymore? You're a sickness care practitioner. This person isn't sick anymore. We don't need to pay for that. So why do we call it health insurance, right? It's not health insurance, right? It's not barely even insurance because it doesn't do anything to stop you from getting sick, right? It just basically treats your symptoms. And especially when we look at the medical side, we end up basically pushing and perpetuating. It's much like the politics that we deal with in this country, that we just put people's problems off for 5 or 10 years, especially on the orthopedic side. Next thing you know, you have to have a knee replacement after some meniscus surgery because you didn't get the right physical therapy, right? So, and I'll put this next bullet point here because it's like, yeah, this is new age, right? At the time, while I'm going through this learning process, and it's still new. Right. And that's the thing that blows my mind right now as I'm going back through this. I was starting to get to the point where I was kind of like, I'm getting a little maybe bored with this or whatever. But as I started going back through all this data and all this information on these slides and everything, I'm going, oh my gosh, this is as bad as it's ever been. It's the worst that it's ever been. Right. So, one of our big issues is that, the evidence-based practice didn't really start until the late 80s, and we're still working on making that curve right now to change. But we're at this point where we have so much information and awareness and marketing and social media behind it, it's become very confusing on what needs to be done. So we're seeing that as a reflection in our culture and our society today, right? So I was